Inflammatory bowel diseases are generally either ulcerative colitis or Crohn's disease. Crohn's disease is an inflammatory bowel disease where the body's own immune system creates an attack against either anywhere from the mouth, the small intestine, the large intestine, the rectum, or the anus. Ulcerative colitis and Crohn's disease differ in many important respects. The most predominant is that ulcerative colitis only affects the anus, the rectum, and the colon. Ulcerative colitis is only a disease of the lining of the large intestine and doesn't cause thickening. Crohn's disease generally begins to affect adults when they're between 16 and 40. Men and women are equally affected. Crohn's disease can result in you feeling pain, diarrhea, bloating. Ultimately, with long-standing Crohn's disease of many years, patients may even develop a stricture and need surgery. Unfortunately, Crohn's disease can't be cured, but the symptoms can be managed. Generally, the symptoms of Crohn's disease are managed with medicines. The medicines are all aimed at turning off different parts of the immune system. The immune system is what causes, and the attack on the intestine is what causes the symptoms that you may be experiencing. Medical therapy is the most important aspect of the treatment of your Crohn's disease. At times, however, surgery is required. You may develop an infection and an abscess, which is a collection of pus around the intestine, a blockage where intestinal fluid and food can't pass readily. You may have bloating and distension of your abdomen because food can't pass through, and surgery is required to address these issues. Colon and rectal surgeons work closely with your gastroenterology and medical teams to help you feel better. When surgery is required, it brings tremendous benefit and improvement in your quality of life. Ulcerative colitis and Crohn's disease are both treated initially with medical therapy. The symptoms of ulcerative colitis are bloody diarrhea and abdominal pain. The treatment of ulcerative colitis initially begins with medical therapy. The medications used to treat ulcerative colitis are those which turn off portions of the immune system. Treating the immune system reduces the inflammation of your intestinal tract and may make you feel a lot better. Ulcerative colitis differs from Crohn's disease in that it can be cured with surgery. Occasionally, ulcerative colitis causes problems which require the need to remove your colon and rectum. These can include cancer, but most commonly involve the failure of medicines to work to continue to relieve your symptoms. Operations for ulcerative colitis always involve the removal of the rectum and the colon. There are options with how we want to restore the flow of food through your body. Sometimes a permanent ileostomy is chosen. Other times, an ilioanal J-pouch is created. The decision to have either a permanent ileostomy or an ilioanal J-pouch is personal and individual. The quality of life, however, with either an ileostomy or a J-pouch is excellent in both respects. Surgery, when it's required for ulcerative colitis or Crohn's disease, can make you feel better and improve your quality of life. Colon and rectal surgeons are experts in the surgical and non-surgical treatment of diseases of the colon, rectum, and anus. We have completed advanced surgical training in the treatment of these diseases, as well as full general surgical training. Board-certified colon and rectal surgeons complete residencies in general surgery and colon and rectal surgery and pass intensive examinations conducted by the American Board of Surgery and the American Board of Colon and Rectal Surgery. We are well versed in the treatment of both benign and malignant diseases of the colon, rectum, and anus, and are able to perform routine screening exams and surgically treat conditions if indicated to do so.